Let's talk all about AI in business. It's hosted by Brent Muller. Welcome to the Future Proof Podcast.
Hi, and welcome to the latest episode of the Future Proof Podcast. I'm your host, Brent Muller. I am joined today by the CEO and founder of Onto Health, Traci Keen. Traci, so glad to have you today.
Hey, thanks for having me, Brent.
All right, let's start off like we always do. Traci, tell us a little bit about your background and kind of your journey up to landing at Onto Health.
Yeah, I have a little bit of a non-traditional background and journey to where I am today. So I started my career in the financial services industry at a bank in Boston. I was trained as a mutual fund accountant. I worked on Eaton Vance fixed income funds. I was fortunate. I graduated in 2003 in really good economy. Didn't have much experience, any at all. Actually, I had studied art and design in college, and they brought me in for an interview. They needed bodies, like if I'm just being totally honest.
Yeah.
They said, we don't normally hire people with your background. If you can make it through the training, you're golden. And
Challenge
I did it.
accepted,
It was,
right?
yeah, I mean, challenge accepted 100%. It was kind of I think about it now and I'm like, that's wild. I don't even know if they still do that, but they would test you every other Friday. If you failed, you were just fired on the spot. So it was a survival of the fittest kind of thing. Got on that Eaton Vance desk, did fixed income, moved around a bit in that company, did some trade ops, went over, sat on the Eaton Vance trading desk for a while, helped bring the middle office over. That bank got acquired by State Street. And then I moved on to a boutique firm, Income Research and Management, started by, we used to call it the Father, the Son, and the Holy Ghost, back in John Summers. And then another gentleman, Bill O'Malley. And then we grew. That company went from, I was the 17th employee. I did all kinds of stuff there. And we went from 17 employees to 100, really short period of time. And then I moved out to LA in 2011 and I did industry agnostic consulting. So that's where I got a lot of exposure. Yeah, it was interesting. I moved out. I was sick of the weather in Boston. I really wanted
I get that.
Yeah, some better weather. And I grew up in Virginia, which is a lot more moderate or like temperate than Boston.
Boston, for sure.
So moved out to LA, met a small business owner who was struggling. And he said, I could use some help, but I can't afford to hire somebody. And I said, well, you don't need to hire anybody. Just get a consultant to come in, do an operational assessment, help you figure out what's going right and wrong. And he said, well, can I hire you? So that's how I started my consulting business, which was interesting. I got a lot of exposure to all different types of industries doing that work. Got exposed to, hey, this business is doing really well, but they have problems here, here, and here. And then I decided I was kind of burnt out past COVID. I was like, all right, I don't feel like this work is as meaningful or impactful as I had hoped for. Started looking around. I came across Mate Fertility and decided to join that company. I thought, number one, I grew up in the rural South, so not a lot of access to quality healthcare, much less specialty healthcare. And so that's always been something like super meaningful and important for me, life goals wise. Like, it
helps when you have a kind of a vested passion for something, right?
Yeah. And, my family, both my parents had a couple of different acute health incidents in my childhood. And, when you don't have quality care nearby, it makes it really challenging.
Right.
It's like another layer of challenge on top of an already challenging situation. And Mate was really focused on geographic access to fertility care and also being a member of the LGBTQ community. We have an acute awareness of the need for ART maybe earlier, and it doesn't feel as rife with sort of this supposition that like our bodies are somehow failing us. It's just a necessary component for some people who choose to do family building that way. So I got really excited about the opportunity. I joined as the head of finance, and a few months later, I was asked to step into the CEO role of that company. And it was the first thing in a long time that it actually scared me career-wise or profession-wise.
Wow.
And
How come?
I think I'm a person who I understand the legal implications of things. I grew up sitting in court with my mom. She was a court stenographer. So I had all this
Right.
exposure as a kid to the legal system. And it's always been something I've been acutely interested in. And I think, quite frankly, anybody who's not a little bit nervous just from the sheer level of fiduciary responsibility and legal responsibility you have as an executive, as the CEO, it makes me worried about them if they're not nervous at all. But I decided, hey, I've been being presented with this opportunity for a reason. And so I decided to lean in, and I was able to successfully exit that company last year. It was acquired. And now, On2 was really born from some of the ideas of mate fertility, but it's really looking at specialty healthcare and the fertility sector in a much different way, a much more sort of, we need to systemically change the way that this part of healthcare is working, in particular, because access is incredibly limited. Outcomes are still not that great. They're not universal, and there's very little standardization across the industry. So I got super excited about the opportunity to take this onto health and grow it into something powerful.
Really cool. Really cool. So tell me about your vision for On2, right? For the audience out there, explain to them how it's different, and then your vision for it, right? Because you're kind of just getting this thing going, and your vision's really cool.
Yeah. So the vision for On2 is to be deeply embedded with automation, AI, robotics, where we can, so that we can create a truly scalable solution for the lack of access and outcome that is currently present in the fertility world. But furthermore, it's also really about taking an outcome-based approach. And I think one of the things that we see a lot is that in this over-specialization of medicine, there's really no threads or synaptic connection between generalists and specialists that drive meaningful patient change or insight. So we know that we get a ton of
We've seen this in
insight.
other areas. So you're hitting on a really good topic there.
Yeah. Yeah. So we know that right now, as it stands, by the time somebody gets to IVF, it's not great. Right. And so we've taken a step back and said, gosh, what are the ways that we could get people aware of sooner, get people insights into their health and their fertility based on their family planning goals and all that. So we kind of take this broader look at it and say, well, a big part of that is connecting and working with generalists, be them gynecologists, be them primary care physicians, and enabling them to start having conversations with folks about their family planning goals, right? That's step one. Step two is getting people some information about their overall wellness. I mean, just because you're in your teens as a person with ovaries doesn't mean that, you have a great AMH and that you have a ton of time on your hands
Right.
to get your fertility underway. So, getting that information about people is really helpful. The earlier, the better. And we do that by connecting business to business with women's health providers, with primary care physicians, to enable them to deliver at least some good quality conversations about family planning goals. And then furthermore, good diagnostics and some other things that can help people. And then furthermore, building it all on systems that we can then get insights about the rest of their health with. I mean, one of the examples it's really important. And, back to one of the things I was saying is what's different about us is we want to be outcome driven. So if someone's goals are to preserve their fertility or to have a baby, those are very different goals, right? How do we get them to their outcome quicker? And if somebody has a condition impacting their fertility, such as PCOS or something like that, well, we could sit there and do repetitive IVF cycles on them, but that's not actually facilitating that outcome at a lower cost. Let's treat the PCOS, and guess what? PCOS patients are not infertile. So we never know then where we can go from there. That person may get pregnant at home on their own once you treat the PCOS. So looking at things more holistically, and a lot of that is really about data architecture. How are you taking information into your systems so that you can get it out in a meaningful way and get the insights about patients and more effectively treat them?
I love that the way you're saying this, because I've always maintained, Trace, that AI, automation, data are changing the dynamic across so many industries to be outcome driven. And this is a phenomenal example of that, right? What you're doing is working backwards from the outcome. And I feel like the way in which you're talking about using the patient's data and then data across similar, right, situations, whether it's PCOS or whether it's just fertility in general, whatever it is, the whole goal is to work backwards from the desired outcome of the patient, right? And the disconnectedness that you were talking about, we've seen that in hormone therapy, we've seen it in things that chiropractic teaches, that disconnection from specialists to generalist is there's a chasm there, and you're solving one of those problems. And so it's, to me, kudos, because you've seen it. You've identified in Entrepreneur 101, right? You've identified a problem and you're building a better way to solve it. And so, I just love that. So Trace, tell us a little bit as you look out right now over the next 1 to 2 years about what you see with the emerging technology and all the changes, right? As it impacts your industry, healthcare in general, what are you seeing and where do you see the opportunities?
And what are the things that I'm excited about for this industry or kind of healthcare in general? A couple of things I'm really excited about. There are a couple of companies that are working on automations, robotics for embryology labs. That's going to be crucial. I think that one thing that we do know is that embryology has come a long way, and I think there's sort of a plateau of, what can be pushed even further towards outcomes. There are certain things that we know machines are just better at, right? So let's leverage them, especially, care and control and custody of tissue. When you're looking at all of these different elements that, get taken care of in the embryology lab, it's upwards of 300 processes that are happening. Which ones are the low-hanging fruit to go after with robotics and automation? I think that's an area where I get super excited because, we often hear about the doctor side of this industry being, supply side constricted, and that's certainly true. But I think that that's easier to overcome than the bottlenecks and the sort of rate limiters that we have in the embryology lab. So I get excited about innovations coming to market in the coming year or two in that front. I also think that, we've seen all of these point solutions flood the market in every industry, including fertility, that, they've created their web app that does X, Y, Z. I think what's going to be really interesting is kind of see the next phase of that, where it's not necessarily about a standalone point solution, but it's more about integrative solutions that you can train based on your systems versus kind of a canned solution with some AI components where you have to fit your system into theirs for it to work properly. So adding these business intelligence layers that are AI driven on top of your core tech components, I think that's going to be very exciting as we kind of see this rapidly evolving AI marketplace. And then of course, like insights that no human would catch. If we can properly use
I was going to say
tools,
that. Yes.
Yeah. If we can properly use these tools, one of the things that I was astonished to read in the past couple of weeks, only 50% of young adults who get diagnosed with cancer counseled about fertility solutions. Or preservation solutions, it's just so sad, and so how do we take those insights that we get and translate them into actions for patients? Because I think what we're seeing is this huge shift. It's been happening for years where we're more informed than ever, but we don't know what to do. And so there have to be pathways to effectually treat or go somewhere with that information. So I think we're at some pretty exciting inflection points.
I totally agree. And I actually think, they say, if you just think about GPs, right? General practitioners. And they're used to seeing like 80% of what they see that comes in their office, maybe more, is the same thing that they're used to. But what happens when it's that outlying 15 to 20% that they're like, wait a minute, I don't know this, right? And that's to me where the AI and the data can come into play and help them steer their patients more towards the right specialist, right? Or the right treatments. And that's for a GP. Right. When we start to get into this, fertility, we start to get into hormones and things that are just outliers that you don't see every day. The ability to aggregate that data to help make better, faster, informed decisions has never been available. And imagine making that available. I'm circling back to your childhood and being in rural parts of the country where it's not available. There's no excuse for that anymore. Right?
Yeah. I mean, at the end of the day, like one of the things I think about all the time, because I do think we're also quite good at jumping over some simple things.
Yes. 100%.
And overcomplicating it. And one of the things I always like use myself as an example, I know my experience better than anyone else's, but I think it's certainly true. And I think it like exemplifies what, there's a layer of cognitive dissonance in what we think our doctors know versus what they actually know.
I couldn't agree more.
Historical, right? Like doctors know everything.
Right.
And it's kind of like socially ingrained into our brains.
And it's just not true. They can't.
They can't. And, we don't know what they don't know, right? So I have always made the assumption that women's healthcare providers know everything about women's health. I mean, that's not true. So, I've been going to a women's healthcare provider for over 30 years at this juncture in my life. Not once has anybody ever talked to me about my family planning goals. And that simple introduction of a meaningful conversation so that you can then point your patients in the right direction to avoid downstream issues. Like it's so simple, but it's so glaringly not present that, I think like sometimes it's hard for people to believe that the solution is not some big bad AI machine. Sometimes it's just introducing the right conversation at the right time.
Yeah. Yeah. I absolutely couldn't agree more. And we really do have a big problem with that. And if you talk about the founder CEO growth stuff, right? If you equate it to that, it's the old saying is that sometimes we're tripping over dollars to get to dimes. It's the same concept. Sometimes we just overlook the obvious, right? And simple things that would move the needle if we just pay attention. And so I love that you said that. All right, Trace. So we were talking earlier about the innovations and the AI, right? How do you see, you already gave us a ton into what's coming, right? I think what I'd like to focus on here is tell me a little bit about how you use AI and your thoughts on it, because we were talking earlier and you use it for so many different things. And I like your outlook on how and when to use it. So if you can kind of go into that would be cool.
Yeah, happy to. I mean, I was definitely, I think, an early adopter of use, first out of curiosity, right? How good is this? And then what can I do with it?
That's kind of night and day from 2022, right? Yeah.
Yeah. And then my usage has evolved over time. I use different tools for different things. Some of them are better at providing, their source documentation, which can be really important depending on what I'm leveraging it for. I obviously use it to summarize thoughts and like some basic things. One is like, how am I conveying information? So if I think I'm being super clear, but it's really important that somebody has the clarity and the like info that I'm trying to like convey. Sometimes I'll just plop it in and it'll reformat it. It'll rephrase it slightly for clarity. So like there's some basic things I do. I also use it as sort of like, be strong where I'm weak, because we as human beings, like we're not good at everything. Like nobody is, like I'm not a coder. I don't know engineering, but one of the things I've been really into lately is, for me in the past, historically, it's been kind of a delta, right? I have this idea in my head of how something should work or look or function. And then I have to translate that to a product person. And then that product person's translating it to engineers. And then it comes back around. Well, now we can go into, Replit or Lovable or some of those systems. And like, I could prototype out an app really quickly.
Yeah.
I can get something that kind of looks and feels and has the basic functionality that I'm going for. And then I can hand that over and say, now, like, make this for real, because it's, technically probably about 75% of the way. But conceptually, think about all that time and all that money we used to have to spend to translate those ideas to the right people, who would then translate it to somebody else, who would then translate it to a wireframer who's gonna, prototype it. And then you're going around in circles. You could just get straight to it from that. And I also think, like, I use it a lot to find out, like, I really aim to be super clear in my communications. Like, where could I be more clear? If I'm creating board materials, I often will plop them in there just to see, okay, what is the point, the key takeaways from this? And it will tell me. And if it's not what I had hoped it would be, I haven't been quite clear enough. So I need to, rework those materials. So, like, basic uses and then more advanced uses. And I think, we will continue to evolve and hopefully leverage these tools in a meaningful way.
Absolutely. And for everybody listening, other founders and CEOs, what Traci was just talking about, where, filling in your weaknesses, that, we're going to be putting out a set of, prompts for you to test and tweak. And like you said, you always have to customize them for yourself, right? And then go back and ask the AI to make it clear, like, how can I be clear? Can you rewrite this prompt for me, but more towards, because it'll learn more about you the more you do it, right?
Yep.
And that's the thing that I think a lot of people miss. It's not just this cut and paste thing. It's an evolution. It's an interaction back and forth. And so one of the things I was telling you before is that we have one for a mentor/advisor, just like you're using it with the board, right? We have one that's going to be more like a chief of staff, and for some of those things. And again, it's just a starting point. That's the part of that I try to tell everybody about AI. These are digital coworkers, right? Right. So if it's a chief of staff prompt, then you're trying to have somebody do some pushback on you for, your materials, then, hey, that's something that you just kind of let it evolve and keep giving it feedback. And I love the way you use it, which is to, hey, could I be more clear? That's not the outcome I desired. How do I make the tweaks to get the outcome I did? And then it almost kind of teaches you some of it, right?
It completely does. And, I find the more time I spend training it, the more I can leverage it, right? And
Absolutely.
even as pertains to, like, there are nuances that make us who we are and make us have the insights that we do. Where did you come from? What's your background? What did your parents do? What was your first job? I've trained my Chat GPT and a couple of other systems with all of these pieces of information, right? So I can get it to, like, really frame things similarly, not totally, it couldn't replace me, obviously, but I've gotten it to make me, I would say, at least 50% more efficient, like, if not more.
Right. And so, Trace, think about that. How many hours do you think by using it and leveraging? How many hours a week or a month do you estimate that by doing it, the things that you're doing with it, does it save you?
If I had to quantify it, I would say, and I'm not advising this for everyone, but on an average week, I probably work 60, 70 hours, a week. It's not for the faint of heart.
Most founders and CEOs are saying this is very similar, right?
Yeah. But I would say that it's helping me to output probably 80, 90, 100 hours of work a week versus, because we think about, like, the time we're spending in meetings. Guess what? I have an app connected that summarizes that, and it's connected. So, like, it's continually feeding my information builder and helping me remember anything on my to-do list, all those types of things. So it's certainly at least 50% increase in sort of my output and capacity.
That's great. That's great. Sorry, my camera's being a little goofy here.
It's awesome. You just levitated.
I know. It's just that the AI camera, unbelievable. So we'll see if it can pick up here. So I told you I was going to ask you a couple of questions, as we get closer to the end here, which is, one, give other founders and CEOs an idea of, like, some of your favorite things that you do outside of the stuff you talked about for you personally that they would find interesting?
For me personally, like leveraging AI, or just me personally for my own sanity?
Both. Any way you use AI, your sanity, or because like I've had some really cool ones where they, I had a CEO of a consulting company, and she had 3 different calendars, and she used AI to optimize it and give her EA that on a quarterly basis to recalibrate her calendar going into the next quarter. And she said, I gained like 10 hours a quarter back. And that's significant.
Yeah, I mean, I'm using it to sort of build case studies and white papers, right? Because I think it's so important, when you're trying to fundamentally change the arc of an industry, right? Like, I really do believe Onto Health can be a category defining and like truly like changing what we're doing for healthcare. I spend a lot of my time writing these future studies of what do I think the industry is going to look like in 10 years? And then what does the AI think the industry is going to look like in the 10 years? How close are my approximations to like, where is this industry going to go? I have my own thoughts about it, but it's interesting to see how close or how far you are from what the AI thinks. Because at the end of the day, we have to always be thinking about, 10, 15 years out in the future and then working our way backwards to today. What am I building today if this industry is going to look completely different in 10 or 15 years, which it will? That's a fundamental fact of life. It will look completely different. And so if I want to have a meaningfully and what I hope to be positive impact on this industry, how can I be better equipped to be building accordingly to fit the goals of what we need? Which, let's be honest, in fertility care, we're only treating about 10, 15% of the people who need it. We've got a long ways to go. So how do we build,
reach more, treat more? Yeah, absolutely.
Yep.
Very, very, very interesting. Not what I thought you were going to say. So I kind of love that.
Yeah. I mean, I'm like thinking, I use it mostly as like a futurist thinking partner, and then helping me kind of build my own conviction, and then also go out there and like start to build the data around, well, is this right or is this wrong? I mean, that's essentially what we're always doing in early stage companies, making assumptions, going out there, figuring out what works, and then obviously like calculated assumptions, and then continuing to plow forward towards the next thing.
Love it. Absolutely love it. So last question, if I could give you the magic wand that you would help you meet or exceed your next 12-month growth targets, what would that be?
It's a great question. I would say that if I could have a database of all of the generalist practitioners who would love to deliver more care in their ecosystem to help people get information about their fertility earlier, that would be the most valuable resource I could get in the whole world.
Nice. All right. Well, remind me. I might have at least a starting point for you there. I do have a few resources, so I will connect you. At least give you a starting point so you can have some conversations. Well, Traci, like I'm so excited about what you're doing with Onto, and I can't wait to have you back to get an update later in the year and see how that growth is going. It's been a pleasure. Thank you for spending the time with us. For everybody, especially if there's any GPs watching this, how do they get in touch with Onto? All the links will be below when we go live.
Awesome. Thank you so much. Yeah, get in touch with me directly on LinkedIn. Go to our website, which is just onto.health. And, I'm pretty quick to respond. And so would love to connect.
I love it. Well, thank you again. And that's it for this episode of the Future Proof Podcast. This is where leaders and technology meet to drive business growth. So thank you, Traci, and we'll get this up and live.
Thank you so much.
If you're ready to embrace change and lead with innovation, be sure to subscribe and never miss an episode. Thanks for tuning in to the Future Proof Podcast.